Assalamualaikum. I'm Dr. Tamkeen Saleem. I welcome you all for the lecture for week 10. The topic of today's lecture is family counseling, which is in continuation with the lecture of week 9 that was also regarding family counseling. However, today we'll discuss about the techniques of Bowen family counseling and structural family counseling. The techniques of Bowenian family counseling are used to focus to create an individuated person basically with a healthy self concept who can interact with others and not experience undue anxiety every time a problem emerges in a relationship. And often the techniques involve a development or a creation of a genogram for assessment of self and family. A genogram is a visual representation of a person's three generational family tree. In simple words, we can say that it's a family tree that helps in assessment of that where the problem lies or in the whole family or generationally where the problems have been there. It is depicted by the geometric figures, lines, and words, and we'll be having a few examples in the next slides that will explain you regarding what are the geometric figures, what are the lines, and what are the words that are used. And there is a worksheet present in the student activity section folder that you would be using, and you will create a genogram for a client, or you may create a genogram for your own family in order to just understand that how genogram is constructed. So genogram actually includes information related to family and its members, relationship with each others over at least three generations. Here, this example is directly from the book that we are using for a reference for the course. That is book of comprehensive. It's counseling, a comprehensive profession by Samuel Gladding. 2016 version I'm using, but the this picture is from the older version, that is the 8th version. In case if you do not have the 8th version, you can see the picture over here. Okay, we'll start from the explanation of that. Below this genogram, you can see that how it is explaining. That is, the square is used for male person and the circular geometric figure is used for the female. Then if it is confirmed marriage, there is a direct strong established line that is showing their interconnectivity or their bonding. If it is a marital separation, it is that bond is basically cut out by a slight slash. Children listed in birth order are indicated through the birth order, and they are represented again by the gender representation, that is a square or a circle. Then if there is divorce, if it's not just a separation, rather it's a divorce, the line that is representing the bonding, it is cut off by two slashes, or you can say there are two slashes that are marked. On the other side, on the right of the below, you can see that there are lines which are showing the interconnectivity, and those lines are actually indicating that whether there is a strong relationship, a close relationship or not. If there is a close relationship, it is denoted by three connecting lines between the two people or three people. For example, in the picture, you can see there are 23, 54, and 87. They are represented with very close relationship. Similarly, if there is a distant relationship, so there are dotted lines. There is no confirmed line, no strong line, rather a dotted line being used. Then we do not find that in the pictograph. However, if there is a conflicting relationship, we find that there is a wavy line that is present, which is indicating the relationship between the two people. If there is some kind of estrangement or there is an emotional cut off, so there is a breakage in the line, which is showing that they are cut off from each other. That again we do not see in the pictograph. Then The fifth type is the fused or conflictual relationship, that is indicating that their relationship is enmeshed. So it's a combo of a very close relationship and it's a conflictual relationship. So that is why we just find it that there are three lines, straight lines, as well as the curvy line that is also there. And we can see that between 55, that is the father, and me, that is the patient 19, there is a conflicting, fused and conflictual relationship between the father and the client. Here we have an example of a client named Stan who is alcoholic. So we can say that it's a genogram of alcoholics and three generational diagram it is, and all those in three generations who have been alcoholics. They have been represented by the half shaded lines. So it's Stan who is basically the alcoholic, and we just try to understand that where we are finding that there is a conflicting relationship and where there are close relationship and so on. So we are also finding here not very strong relationship, weak relationship. The dotted lines are also there that you can see. So mom of Stan actually got married to his dad after dad stopped drinking and he joined um the intervention program for the alcoholics. But actually, they had very contentious life. When you talk about the mom of Stan, her father actually drank or used to drink, and he also took help from an intervention center for alcoholism, and he was helped out. Then the mother of mom of Stan also drank, but she used to deny the problem that drinking is not the problem. On the left side, we see Matt, who is actually Stan's sister's husband, who also drinks, just like Stan. And Stan's mom has problem with Stan as well as Matt. Carl, the younger brother, there you can see two lines that are associated with between the Carl and Stan. It is indicating that they are close together, right? So what we say here is that Angie, the mother, is having problems with the drinking behavior of Matt and Stan. And she had experienced her mother Martha and father Tom, who were alcoholics, and her husband Frank, who also used to be alcoholic. So now she is having Stan and Matt, who are basically alcoholics. And Carl is also close to Stan, so she has a fear that Carl may develop this behavior of alcoholism. However, we also find that Stan, that is the client, is distant or disengaged from father. As you see, there are dotted lines, as well as the brother Frank Jr. So we just find it up that there are problems between the family members and there is history of alcoholism. Other techniques involve content-based questions, which are used in order to explore about the cognitive processing of the individual. Similarly, these questions to explore cognitive process are objective in nature in order to understand that what happened in one's family with the emotional overlay, and that helps in order to resolve the problems. Another technique that may be used is go home again. That is, the individual is asked to visit the family in order to know those aspects about which they are not aware, and in order to rebuild their relationships. Another technique is person to person relationships, that is on there are different diets that are developed within the family, and they try to understand that what sorts of diets are present. For example, um, client to mother relationship, that is one diet. Client to father relationship, that is another diet. Client to brother, that is still another diet. Client to sister, that is another diet. Then grandparents, that can be another diet. So it's important to understand. So questions are asked regarding their relationships. Then asking of the questions, events that had an impact on the family, such as death, birth, and marriages. As Bowen emphasizes the importance and role of triangulation, he also talks about that it's very much important to detriangulate it, which involves the process of being in contact and emotionally separate with the other people. Triangulation has two levels. First one is to resolve anxiety over the family situations and not to project the feelings onto others. And the second is to avoid becoming target or a scapegoat for people who may be overcoming or who may be overflowing with anxiety. Differentiation of self is also worked upon, which is the ability of a person to distinguish between subjective feelings and objective thinking. It involves some confrontation between the client and the counselor so that the individual is able to differentiate himself from the rest of the family. Structural family counseling is a method of psychotherapy or psychological counseling that was developed by Salvador Minuchin, which addresses problems in functioning within a family. The structural family counselor strives to enter or join the family system in the counseling in order to understand the invisible rules which govern its functioning, map the relationship between the family members or between the subsets of the family. This is the thing that actually talks about the subsets of the family. We'll be discussing that shortly. And ultimately disrupts the dysfunctional relationship within the family, causing it to stabilize into healthier patterns. He started off his therapy at a school for the delinquent boys in 1950s. He said he used the techniques of self-taught, collaborated with a variety of other thinkers like J. Haley in early 1960s in order to develop his strategic family therapy. There are a few underlying assumptions of structural family counseling. That is, the families are competent and capable of solving their own problems. And this assumption is basically derived from the existential humanistic tradition. Counselor works collaboratively with the families, not as an expert who can solve the problems, but serves as a consultant and coach in order to work to bring the family's dormant capacities to the surface. The council respects the family's unique culture because every family is different and they have different regional and ethnic background, and then there are different rules and settings within the family. So the council is required to respect all that. But the question should be not that what's ideal, but Does it actually work for them or not? Structural family therapy or counseling is the beginning of the postmodern approach, but it retains some traditional views concerning the importance of power and hierarchy of the family. In order to understand the whole process and system of the structural family counseling, there has been some concepts and definitions provided so that a family can be easily understood. The first terminology or the concept is structure, which is an organized pattern in which the families interact, not deterministic or perspective, only in this descriptive form. It is partly universal and partly idiosyncratic. That is, there are a few things which are common in each and every family, and there would be specific things, specific patterns, which will be specifically aspects of that particular family with which the counselor is dealing. Can only be seen when a family is in action because the verbal description really conveys such kind of structure. It is also important to notice that if we ask a family member what the problem is, what they generally describe is not actually the problem. So we have to dig in more in order to identify the structure and in order to understand that what is happening. This theory and therapy talks about the subsystems. They consider that family is a whole unit, but there are subsystems in that, and we need to focus on that how the patterns exist between them, how the communication, how the relationships are between the subsystems as well. So subsystems are basically the subgroupings within the family based on age or generation, based on gender or sometime interest or function. And generally, broadly, we classify subsystems as parents, spousal relationship, parent-child relationship, and sibling relationship. Boundaries are invisible barriers that regulate contact between the members. Um, They may be diffused, they may be too weak, or too much close that we call enmeshed, rigid, or too much fortified, barriers around them, or completely disengaged with each other. Additionally, boundaries are reciprocal in nature. That means that a weak boundary that is enmeshed in one relationship usually means that the same person is disengaged from someone else in the family. For example, let's suppose there is a wife who is enmeshed with a child, very much close with a child, but on contrary is disengaged from the husband. Similarly, we can have another example that there is a father who is very much close and enmeshed with the old son, who plays with them, who goes out with him, but is disengaged with the daughter, who is not interacting much with the father, and due to which there is a possibility that is she is depressed and quietly secretively she is harming her own self by making the cut marks on her wrist or some part of the body. Coming to therapeutic goals, structural family counseling is different from others, or we can say that something that differentiates structural family counseling from the other forms of family therapy is that there is an emphasis on modifying the family structure in the immediate context of the family therapy setting. When new patterns are repeated, they result in improvement of the family relationships. They will stabilize and replace the old patterns without having to keep supporting them, which means that when there is reinforcement that is going on, so new things are being liked, being preferred, being appreciated or appraised, so they are held by the individual. Not a matter of creating new structures, but it is actually a matter of activating something that is dormant. Techniques of counseling in structured family counseling. The first one is working with the family interactions. And how a counselor works with that is that they inquire uh, family members' view of the problem, and they also track the sequence of behaviors that can be utilized or that are used by the family members in order to explain the problem. The counselor can rearrange the physical environment so that they can have to act in a different way and interact face to face with each other. For example, those who are disengaged from each other, they may be made sit together and communicate together or face each other from face to face. Similarly, another technique is reframing, in which the counselor helps the family see a problem from a different and more positive perspective. For example, there is a misbehavior, or there's a behavior, we would say, and that is perceived by the family as a misbehavior. That is reframed, or you can say that that is relabeled as a naughty behavior or naughtiness in comparison to something that is labeled as crazy. There is use of another technique that is called punctuation. The selective description of a transaction is there, that is declaring a person to be competent at specific moment. So the punctuations are made in order to present something in a different manner. Then another technique is unbalancing, that is, the counselor supports an individual or the subsystem against the rest of the family. Enactment is another technique that is used in which a family which brings upon a problematic behavior to a therapeutic session, such as difficulty in making the decisions, they discuss them, they demonstrate them, and they try to enact upon them, that they try to create something out of it. The counselor challenges their existing patterns and rules as the family gets awareness of the way they function, and they try to change them and modify them. Boundary making is another technique in which the counselor creates lines that separate people or the subsystems from each other. Rather, we can say that counselor helps the family make lines. Um, and this may be done psychologically in order to maximize the individual as well as group level functioning. Intensity changes are made in the maladaptive transactions by using strong affect, repeated interventions, or prolonged pressure in order to help an individual or family member to reach the goal. SFC techniques use restructuring, which means that altering the existing hierarchy and interaction patterns between the family members so that the problems are no more maintained. Then another technique that is used, that is based on the cognitive aspects of the individual or the family, is adding the cognitive constructions. That is the verbal component that is primarily action oriented. It includes advice giving by the counselor, information provided by the counselor, and pragmatic fiction sometimes is used. There are various types and techniques of family therapy that are used across the globe. Some of the techniques used in creative art therapy are provided in reference material for week 10. However, many other types of family therapy techniques or family counseling techniques are also provided in the reference material for week 9. Some techniques and activities are also given in reference material which you may use in your internship. You have to only, that is just a handout that you may utilize in your future. However, the activity that is given in the student activity section, you have to perform that for this week. I hope the lecture is clear to you. If you have any queries, you can always ask me through WhatsApp or you can write me in the Google Classroom chat. Thank you so much for listening. Thank you folks for watching. If you like this video, make sure to subscribe for more and like and share the video. Click the small bell icon that appears beside the subscription button to receive the notification the minute our video is uploaded. Thank you for watching. Allah Hafiz.